On health, lots of talk about how we don't spend enough on health, lots of talk about the broken health infrastructure. What I found particularly puzzling about the public conversation that we had in March 2020 is actually parts of India have dealt with pandemics and epidemics relatively well through the public system. We managed Zika, we managed Nipah. Without shutting down, instead of drawing on those lessons to say that maybe we can build public trust in the health system and we'll find ways to make it work, we did what the rest of the world did. We shut down, knowing fully well, I don't believe that any single policymaker in India doesn't know that most workers work in precarious conditions and they come to towns and they will be left with nothing if you shut the economy. We did it knowing that, on the argument that the public health system will not be able to cope. We need time for preparedness. Why we don't trust the health system puzzles me enormously. And we managed to do this massive vaccination drive, at least until the boosters, on the back of the foundation that we built through the public system. It was the ASHA worker, the A&M that were going, braving disease, not one. We did some surveys with frontline workers through this phase. And what was interesting to me is how much struggle it was to get my colleagues at CPR to turn up to work because they were scared of disease, and fair enough. But nobody in the frontline Indian state said, I'm not going to go on a house-to-house awareness drive. They went. They braved what was a very frightening scene to do their duty and do their job. So these are opportunities to say, can we start believing in the possibility of the public health infrastructure? Because until we don't believe in that possibility, we are not going to have the capacity to put money into it. We can keep talking about it, discussing its fiscal implications and so on, but we will not prioritize it if we don't believe it can actually be done. And now we have case study of parts of the system when you believe in it, when you push it, it actually works, it works well. So I think these are the lessons we should remember from it.